Hello, everyone. I'm Dan Faulkner, Registrar and CEO of the Royal College of Dental Surgeons of Ontario. Thank you for the opportunity to speak to you about the college's work and about issues impacting the dental profession and our regulatory landscape. We get invitations from dental societies across the province, and I'm unfortunately not able to attend all of these meetings in person. We do want to engage with dentists and the public so that you're informed about the progress we're making and our plans for the future. I really appreciate your interest in the college, and I'm delighted to have a chance to talk about the work we're doing. I have 6 topics for you today. First, strategic plan and college resources. Second, the Professional Liability Program, or PLP. Third, RCDSO department highlights. Fourth, our governance landscape. Fifth, a provincial and federal update. And 6, our strategic partnerships. I'll start with our strategic plan and college resources. The strategic plan has 6 priority projects. College standards I will speak to later. Access to care is related to how patients in Ontario access essential oral health care services. Service experience is about the service that we provide to you when you contact the college, that you have access to timely and relevant information to address your concerns. Our 4th project is related to equity, diversity, and inclusion. This is how we operate as a college. This is how we will regulate in Ontario. And this is about how the profession will practice in Ontario. If our public doesn't trust us, then they won't contact us for valuable information. So EDI is a very important strategic project for the college. Our 5th project is governance review and modernization, and I'll speak to that shortly as well. And finally, practice models and corporate dentistry relates to the various ways in which dentistry is practiced in the province and how we can best regulate within those models of care. Many of you will have already had a chance to access the enhanced e-portfolio system at the college. You will note that there are different ways for you to search for continuing education courses, that you are able to readily upload your certificates of education, and your CE points are automatically calculated so that you can see the dashboard. You can see at a glance where you are with respect to your different categories of education and the total points that are required over your cycle. We also have automated a number of features, including an automated notice that you will get as your cycle approaches its end date, so that you understand the number of points that you may still need to gather before the cycle is over, rather than after it has ended. Standards development is a very important area for the college. We're setting priorities about the standards that are relevant to you and your practice. We have 20 or more standards that are available from the college. We need to update and refresh many of those. We also have requests for new standards that are related to dentistry in 2024 and beyond. We need to develop priorities and look at those standards that will be developed that are risk-based. We also need to do extensive research on our standards so that there will be literature reviews that back all of the content. They will be evidence-informed, and they will be informed by a collaboration with experts who reach consensus. There will be transparency in our consultation process. We will send out surveys or emails to get your feedback and the public's feedback about the draft content of those standards. Committees will be involved in the review and development, and council will also be able to provide their feedback about the direction and the content of the standards. And finally, council will approve all standards before they are finalized and posted on the RCDSO website. Here's an example. The virtual care standard of late last year started with a working group that was commissioned in 2019. It led then, with the emergence of the pandemic, to content within our COVID guidance document, and then as the pandemic progressed into 2023, we developed interim guidance for teledentistry or virtual care. And finally, in December of 2023, a standard was approved by our council that helps you to understand when you're going to be providing virtual care, what are the appropriate expectations, or if you're going to be sending your patients to other dentists out of the province, what are the expectations for those dentists? I'm going to turn now to our Professional Liability Program, or PLP, as you know it. Early last year, in January of 2023, the college commissioned an expert review task force. This task force reviewed the program, and it provided a risk and benefits analysis and recommendations to council. It found that the current program operates very efficiently and very effectively. It was there to really look at the risk landscape and whether the college should step back and reconsider if the risks outweighed the benefits. You have a QR code on your screen. You can go to the website and you will find the full report. The risk-benefit analysis contained a lot of detail, and I will first focus on the benefits of PLP. There's clearly access to coverage for every single dentist in the province. That is of great benefit to a patient who has been harmed and may seek compensation due to negligence or inappropriate compliance with standards. There's also public ease with the program in that the compensation, when warranted, is available in a very accessible manner. And finally, for the college to operate the program, it can have some influence on the type of coverage for all dentists. But of course, there are a number of risks associated with a regulatory body running or directly operating a professional liability program. There are risks to reputation, there are risks financially to the regulatory assets, and there are risks to the regulatory mandate of the college, which has a duty to serve and protect the public interest. All of these were considered by our council, and in September of 2023, council directed that staff look further into divesting from PLP. As part of that review, the staff commissioned a survey of all of the profession. 11,000 members were sent a survey to understand what you value in PLP that will help to serve any possible divestment of the program from the college. We had a 15% response rate. Over 1,600 of you provided extremely important information to us as we looked at the various attributes that are important. Many of you were very positive about PLP, both in terms of your accessibility to the program and the ease with which you had access to competent and expert staff members who could provide you with the advice that you needed at that moment in time. The main topics of concern that we learned were about the cost implications and the fear of repercussions by having all malpractice insurance associated with the private sector insurance. Overall, though, many respondents highlighted the value in maintaining certain aspects of the PLP model. And from this information, we were able to glean a couple of very important factors. First, that you wanted us to maintain a fair and reasonable cost in any divestment. And you also wanted to ensure that there is adequacy of coverage. The full survey results are available on our website, and I would encourage you to go there and have a look, as these will be important inputs into the divestment process. With all of that information, Council in December directed that staff proceed with the exploration of transferring PLP to a third party. Council directed staff to begin a divestment process, and this will happen in 2024 and beyond under the guidance of the Executive Committee or its delegate. I'll turn now to RCDSO department highlights. The first highlight is with our registration area. There's a number of key points from this graph. First, starting in January 2023, the college was obligated to meet certain timelines in accordance with regulations. You can see from this graph that relates to application processing time that as of January 2023, The blue line represents the average time for our processing of applications, and the dotted line represents the regulatory requirement of 15 days. For a year now or more, the college has been able to keep our timelines under the regulatory requirements. The Facilities Inspection Program, or FIP, also deals with applications for CT facility permits. This has been an area of concern with some members of the profession that our timelines were too long and that there was a backlog that we needed to better manage. The graph in front of you shows the applications that came in during the different years that are on the bottom and the fact that we are moving forward to decrease those from the earliest years. The lines represent a slope downward and approaching zero for those years from 2020 to 2022. And obviously, we've just come out of 2023, so that line continued to move up throughout the year and will also be as processed as quickly as possible. You can see also that of the applications remaining from 2020 to 2022, over the course of 2 council meetings, that number went down as would be expected. From our Professional Conduct and Regulatory Affairs area, or PCRA, this graph represents the number of open case files. And I would draw your attention to the dark blue line, which indicates the number of files that are opened in a particular month in 2023. And for all cases, with November and December still to be reported, the number of case files has dropped. And in fact, in October 2023, there were 480 open case files, which represents a decrease of 7% from October of 2022, 1 year before. Our goal is to obviously provide due diligence in our investigation of all files, but also to move much more quickly than we have been. And this graph represents some of those results. This graph also looks at the files that were opened in our investigations area from 2019 forward. And you can see that those dotted lines representing a downward slope are rapidly approaching zero. These are files that were opened in 2019, 2020, 2021, and 2022. And for those files, you can see that over the course of last year, where in April, 20% of those files were opened, as we got to December, only 6% of those files started in 2019 to 2021 remained open. So again, another representation of how the college is trying to reduce the backlog of those files. I'll turn now to our governance landscape. You can see there are a number of organizations that are involved in different ways in governance changes or reform. From British Columbia, we have the new British Columbia College of Oral Health Professionals. This is an amalgamation of 4 colleges and now regulating 6 oral healthcare professions. You can see that the College of Dental Hygienists of Nova Scotia and the Denturist Licensing Board of Nova Scotia have now amalgamated on the East Coast. Our College of Dental Hygienists of Ontario has commissioned its own governance review, and the Order of Dentists of Quebec is watching carefully its Fairness Commissioner and changes that are happening with other health professions in that province. For RCDSO, we have a number of successful achievements over the last few years. Last year, we formed a new governance committee. The governance committee is now taking over the role and responsibilities of 3 other committees. It was established in September of 2023 and has worked throughout the fall to make a number of recommendations and changes already. The committee itself consists of 2 professional members or dentists, 2 public members, and 2 governance experts. And their responsibilities are to oversee the entire governance operations of the college. And this will include nominations to committees and for chair appointments. This will include competency-based selections for who will be able to run in elections for council, and will also include other selections, such as our academic representatives. There will be a number of other additional governance changes that will take shape. All of this is done on our own accord. There is no current mandate for reform by the Government of Ontario, and our CDSO continues to try to be proactive and stay ahead of those possible reforms by looking very closely and carefully at how we govern and are we meeting best practices from around the world. I'll talk a little bit about some of the provincial and federal updates that we need to pay careful attention to as we navigate a number of changes in the environment at both levels. From a licensure perspective, there's a piece of legislation known as the As of Right legislation in Ontario. Most of that legislation deals with moving healthcare procedures out of hospitals and into the community. But there's a small portion of that legislation that looks at interprovincial mobility of those individuals from 4 professions who are licensed in other provinces and how they can move to Ontario. And when they come to Ontario, they are not required to be licensed by their respective college for up to 6 months. These professions are medicine, nursing, medical laboratory technologists, and respiratory therapists. This doesn't impact dentistry yet, but we're watching it very carefully because we know that it could impact dentistry, and we want to ensure that the regulatory system is consistent and equitable for all. Another regulation that was passed that directly impacts the college and all colleges in Ontario relates to an emergency class of registration. This was required by the government for all 26 health colleges, and our CDSO approved a regulation which was formally signed and sealed by the Ministry of Health in August 2023. This will allow for, in emergencies that are invoked by either the Ministry of Health or by the Council of our CDSO itself, for individuals to practice in Ontario but not having to achieve the full set of qualifications. And those individuals will work under supervision in a dental practice in Ontario until the emergency is declared over. We are working with a group to develop supervision guidelines for any practice that finds itself overseeing individuals who come to Ontario under the emergency class of registration. We're also paying very close attention to the Fairness Commissioner in Ontario. The Fairness Commissioner is very focused on dentistry and the national examination process for internationally trained dentists. And we are working with the Commissioner and the Ministry to ensure that they understand the validity of those examinations, the competencies that they measure, and the fairness and objectivity of those examinations as well. And finally, access to care, as you all know, is a very significant issue in Ontario and in Canada. I want to draw your attention to a new regulatory oversight body in Ontario called the Health and Supportive Care Providers Oversight Authority. This is a new body that is intentionally designed to not have all of the same requirements that the Regulated Health Professions Act has for dentists and many other professions. The first group that it's going to oversee will be personal support workers, or PSWs. The concept will be a register of those individuals who are within the PSW profession, and the concept will also allow for other health professions to be regulated within this particular oversight authority. There's lots of details that we don't know yet, but we are certainly following this to see what impact, if any, it will have on dentistry or the Regulated Health Professions Act more generally. Access to care, as I've mentioned a few times in this presentation, includes the Canadian Dental Care Plan, or CDCP. All of you are aware of the details that have been provided about the Canada Dental Care Plan. This is a plan that will provide access to essential oral health care for many Canadians. Close to 9 million Canadians will be eligible for the plan. Access to care, as you know, is an important part of the college's strategic plan from 2023 to 2025. The college will continue to encourage in a variety of ways for oral health care practices to enable access to care for patients in Ontario. You can find out more about this plan by visiting the canada.ca website. There's a QR code on the screen that will allow you access to that website. And we will continue to provide, as will the association, you with more information about this plan and its details. I'll turn now to strategic partnerships. Collaboration is an essential component of RCDSO. Over the last few years, we have collaborated in different ways with the other oral health regulators in Ontario. This is essential both for providing quality care and enabling better team-based care in your practice. We've worked with the other colleges to ensure that our guidance document for COVID-19 was consistent across all 4 professions. We're now talking about how we can work together to update the infection prevention and control standards. We recently published an article on mandatory reporting by health professionals as a reminder that health professionals have obligations to report to the college under certain conditions. And all 4 of our councils or our boards of directors work together to participate in training to allow us to better understand Indigenous culture, humility, and reconciliation, and how that will make us better regulators. We have other partnerships, and I've mentioned these as well during the presentation. On the issue of licensure, there's certainly many things happening at both the provincial and federal level. We work very closely with the National Dental Examining Board of Canada, or the NDEB, with the Fairness Commissioner and the Ministry of Health, as I mentioned earlier, to ensure that those individuals who are licensed are able to practice safely upon licensure, and will also know that they are partaking in fair, objective, and transparent credentialing and licensure processes. I want to wrap up by noting that you can reach out to us at any time. Our practice advisory service is ready to answer your questions. Stay tuned for upcoming RCDSO Connect sessions. Our first virtual session takes place on February 28th. We're also excited to host our first in-person session on June 25th in London. More details and information will be emailed out to you soon. We hope you can join us to hear more about topics with immediate impact for the profession. I also encourage you to follow us on social media to hear the latest news and updates from the college. Be on the lookout for our first newsletter of 2024, which will be published in March. Thank you so much for your time, and please don't hesitate to reach out to us.